the actual diagnosis of depression is so immensely complex.
Okay.
And so I think though that kind of thing often needs defined first, because a depressed state or being transiently depressed differs from having 5 of the established symptoms that last longer than 2 weeks. Like, so basically I'm not envious of the clinicians that have to parse through that in making the diagnosis of depression. And so with that, if they get their diagnosis slightly wrong,
right,
or maybe the patient wasn't reporting things properly, they may have chose the SSRI when it should have been the SNRI, or they have a health condition that may be perpetuating the depression, which would warrant a whole separate, path of treatment. So it is so hard, just like from the get-go, to get depression right and to make sure we're all talking about the same thing and to make sure the clinician and the patient are on the same page.
Right.
And so then what further complicates that, or the way you see this manifest itself, is maybe some side effects because it wasn't the right choice.
Right.
Or, if you're an agitated, more of the agitated type of depression, and you do something like, an SNRI, it has the potential to increase that level of agitation. And I know, I could kind of get lost in the weeds with some of that.
Sure.
But it just further validates the complexity of it.
Are these the same drugs? I know of when we've had school shootings and things like that, I hear a lot of murmuring about such things in some of the fringier press.
There is a black box warning for teenagers. Yeah, that paradoxically it can lead to suicide attempts and suicidal ideation. So that is definitely a separate, more of a rare side effect, but that is definitely out there.
But it is real.
It's real. It is real.
But you were talking about other things that maybe would be more effective depending on the situation. So starting with, we're not talking about just being sad. That if your dog dies, you should be sad. That's a legitimate, normal, natural reaction to a situation like that. And there's nothing unhealthy or wrong. What should you do if you find yourself in a blue situation like that before turning to pharmacology?
Sure. I mean, you would hope that you have the right clinician.
Yeah. So you're talking about get professional help first.
Yeah, I think it really varies in terms of how bad things are for you. That subclinical type depression, an event happened.
Subclinical meaning not clinically defined depression,
according
which is where
to
you got
Dante,
the checklist of
subclinical
so you're not
depression. There. Yeah, I think it is a great idea to talk to somebody. Very, it can be formally, it can be weekly, it can be monthly, but I think it is a good idea to talk to somebody, especially again of a grieving type situation.
Sure.
But again, like the things we had talked about, spouse leaving, issues with kids, there's so many different things there. So I think for me, it's what really this comes down to in kind of backing up is this is such an individualized thing. And when you see a reductionist way of putting things like Dante mentioned, that does become a little scary because sometimes if you've had things pile up in your life, you may need to be on SSRI for 6 months.
Yeah.
Now, if you just are on SSRI for 6 months, you don't get any CBT or some counseling and some therapy. You're not getting up in the morning. You're staying in bed all day.
Yep.
No exercise. You're eating foods that are inflaming your body and aren't good for you and that don't contain nutrients to help your body produce neurotransmitters. You're not doing anything else besides taking this pill and you're hoping it's gonna fix you. That's where we run into a problem. But then on the other hand, you've been through some catastrophic things and you need something for a period of time. Yeah. I don't think that there's anything wrong with that. So I guess, Dante and I are not going to be reductionist about this. I could talk to 10 different people and have 10 different opinions of what maybe they should be doing related to an SSRI.
Yes, I think you said it earlier. This is a very, very individualized situation that this sort of thing, especially these sorts of drugs, really need individual attention. And a study like this isn't saying it's never appropriate, don't ever do this, even if that's what the headlines seem to scream. That's not the point.
Right. And one thing we'd be remiss to not mention,
yes,
if you are on an SSRI,
yes,
do not stop it abruptly. There are ways to do it. If you've made that, again, individual decision,
yes,
make sure that you do it with a clinician. You've got to wean off. There's many side effects. You'll have basically rebound anxiety and/or depression. There's an unusual kind of neurological phenomenon that happens called brain zaps that people get, little like shooting sensations in the brain. So just be very careful, because then that's just going to put you back on the cycle of, I can't get off of this,
right?
You know, and maybe there's, again, more of an individualized approach that can get you.
Yeah.